This segment of DelmarvaLife is brought to you by Delmarva Dental Services.
Well, if you ever had braces as a kid, then you probably got called metal mouth more than once. But once you got them off, you were proud to show off that $1 million smile, weren't you?
Or perhaps you didn't have braces but needed them and are still living with a smile that could use some improvement. Well, guess what? It's not too late, and you can get the treatment without living with a mouth full of metal. Dr. Lee Aki of Delmarva Dental Services showed me how. Dr. Lee Aki of Delmarva Dental Services knows how important straight teeth are to a person's smile.
I think having a pretty smile, nice straight white teeth is something that a lot of people do wish for. Maybe they've had it in the past, maybe they just have seen other people with it, or it's just something that would make them feel more confident. So it's definitely something that a lot of children and adults both look forward to having.
But there are other benefits to straight teeth other than a pretty smile.
So while we typically would look at orthodontic treatment or a nice white straight smile as the appearance aspect of it, we also are talking about the way in which your teeth might bite together. So sometimes you can have a harmful position for your teeth to come together, and realigning them may make that more stable.
Dr. Aki says overlap of the teeth can cause buildup of tartar and gum inflammation, and that can increase your risk for periodontal disease. That's why Dr. Aki says orthodontics are not just for kids, and orthodontic care doesn't necessarily mean having brackets and wires in your mouth.
But now, with the advent of some of the invisible braces and that sort of thing, a lot of adults are pursuing treatment that they may not have had the opportunity to pursue when they were a child, or they've had traditional orthodontic treatment and have had relapse over time, and they'd like to pursue something else, but they're not interested in the metal appearance of what regular braces would look like.
Most people have heard of Invisalign.
It's just a series of clear aligners that help you reposition your teeth.
The aligners are custom made after what's called an orthodontic workup is done. That begins with a series of photographs
showing your smile, showing your profile, the position of your jaws, showing the arches of your teeth, showing what your teeth look like when you bite together, showing where there are spaces or where there is crowding.
Dr. Aki says impressions of your teeth are also made to create digital models of the mouth, and x-rays are used to look at the jaw form and the profiles.
Once that happens, the dentist uploads all of your digital information into Invisalign, into a specific chart just for you. They enter some information regarding how they want to move your teeth, what teeth may not want to be moved, say you have an implant or something like that that can't be moved, and Invisalign will return us a digital model with a little video that shows us the movement from point A to point B and how are we going to get there. And then we can say, okay, here's how long it takes to get from here to here.
Dr. Aki says being able to show the patient where they're starting and where they will end up before they actually begin treatment is really powerful. The treatment takes some time because moving the teeth involves bone resorption in the direction of the movement and bone regeneration in the space the tooth used to take.
Oh, you're not going to go to sleep one night after wearing a tray and wake up with perfectly straight teeth, and actually that would be very harmful to move them too fast. So it is a predicted movement with a light applied force or pressure that moves the teeth slowly from one position to another.
Each Invisalign tray is typically worn for 1 to 2 weeks. If a patient has crowding of the teeth, there may be a need to reshape a tooth to make room for the movement. Another advantage of Invisalign, patients don't have orthodontic emergencies.
You don't have wires breaking, you don't have brackets coming off. You know, they call the office, we bring them in, we can take care of it pretty easily and without any discomfort.
And because Invisalign trays are removable by the patient, daily hygiene is not a problem.
They pop it out, they can brush, they can floss, they can do their mouth rinse, they take it out when they eat and drink.
And once treatment is completed, Dr. Aki says patients say the results are worth the process.
It's really cool to see how happy they are and the confidence that they get to have that new smile. It's really rewarding.
And Dr. Aki says that once the treatment is completed, patients will have to wear a retainer, which may look just like the Invisalign trays, or in some cases, maybe wires bonded to the tongue side of the teeth, so you can't even see it if someone's looking at you. And I have to tell you, we're going to do a little bit more on the Invisalign with Delmarva Dental Services because it's really an amazing product. But we were talking to some people who've had it done before.
Right.
And one woman was saying that she actually lost weight using Invisalign because you have to take them out whenever you eat, and and then brush your teeth and
Right.
everything and put them back in. And she said because she didn't want to do that every time she wanted a snack, she didn't snack as much.
skip
She was
it.
just like, oh, I don't feel like taking it, so I'm just not going to snack as much.
about
And she
that?
lost weight.
Wow.
Isn't that interesting?
That is, but I guess, I mean, seeing that makes me understand how important it is for you to have that person-to-person, face-to-face contact
Right.
when you're doing something like this.
It's not a one-size-fits-all by no means.
Yeah.
Yeah.
Well, all right, there you go.